So what I do for community healthcare, my main area of focus is I focus on bringing really good providers to our clinics. So I recruit our doctors, nurse practitioners, physician assistants, and our dentists as well. I don't know if you all know, but so community healthcare, we're focused on primary healthcare. We've got 8 clinics uh, spread around the Quad Cities and a newer clinic in Clinton, Iowa. 3 of those clinics have dental care as well. We focus on servicing the underserved community here. We take patients of all walks of life. So whether that's insured, Medicaid, Medicare, non-insured, you name it. But so we have patients with Blue Cross Blue Shield, just like we have patients with Medicaid. But that being said, we were founded 42 years ago, really to be a safety net for the community. Excuse me. When it comes to healthcare, and I think one of the things that get lost on some community centers or some health centers in some communities across the country is that we're going to have inadequate or not as good healthcare in those facilities that we would at one of the other larger medical facilities here. So we try to bring in the best physicians, the best providers and dentists that we can. And in addition to that, I also help market our services throughout the community, and I'm involved in a lot of community events as well. So.
Community healthcare is a real player. And as Sean has already indicated, they are a serious player. I do business with them indirectly in that I write insurance, Medicare clients, as well as what is called dual eligible, Medicare and Medicaid.
Practices, unfortunately, right now are going farther and farther away from accepting Medicaid, and in Illinois specifically, um, I, I won't say a name. One of the large hospital groups here in Illinois quit accepting one of the Illinois Medicaid providers altogether, Illini Care. If anybody's ever heard of that, yeah. So, but we accept every single form of Medicaid, every single. We accept about 98 or 99% of all private insurances. And again, we do have, if I can mention, what we do have that's unique as well, I think unique to any other primary clinic in the Quad Cities, is that someone comes to us, whether they're insured or not insured, they can apply to get on our sliding fee scale. So the sliding fee scale is a payment scale based on your household size and your annual income. So some patients that may have Medicaid or insurance through, as has been said, Obamacare or the Affordable Care Act, may still have fees along with that, of course, whether it's copays or whatever. So you can be on a sliding fee scale whether you have insurance or whether you don't. And that sliding fee scale, for example, if you're at the top of that scale, you can come have an appointment, whether it's to treat an illness like diabetes or an acute situation for a cold or whatever it is, for $20 out of pocket, insurance or not. So I did want to mention that too.
Maybe that's the problem. And I guess, like I said, I'm a parish nurse. I've been that for 20 years, and I guess I've been trying to stress to my parishioners and everybody, if you don't think something needs to be done, just say, hey, explain to me, or maybe I need a second opinion. If it's not bothering you, if you haven't had that serious of a problem, to say, what is going on? Why do you feel I need to have this done? Tell me why. Or I need a second opinion, because, that's your body. If you know your body, he's just walking in there and saying, hey, let's take this out. Whoa, back up. Why? Pull his coattail. You gonna tell me something. If you gotta block let's say your wife is shaking her, if you have to block the door, you make him tell you, why does my husband have to have that taken off? No, and say, hey, why? And if you don't feel you need that, then I need a second opinion. That is your right. And maybe I'm not making sense, but so now you've got 2 copays and you don't know why. And maybe I'm not making sense, but if you didn't think you needed it, you didn't have to have it done.
I mentioned in the beginning that at CHC, we are really at a point where we're striving to bring the people we serve excellent patient care and patient-centered patient care. I think there was a time years ago under older, different administration at CHC where they may have had to take who they could get type of thing. The culture has changed over the years to the point where it's not that type of environment there. So we definitely screen. So you have to have a clean record. There's a couple different ways you can check out any type of provider, whether it be dental, medical, you name it, from a state level and from a national level. And I have, just in my time here at CHC myself, I've had to tell physicians that have tried to apply to work for us that we can't hire you because of your record. What I've seen the most of in the last year and a half or so is docs that have been reprimanded for overprescribing medicine. You see that a lot. And I think it's one of those things where years ago, they didn't have as many checks and balances. At least I believe. My medical background doesn't go back years and years, so I'm not 100% sure on that. But I think the checks and balances on just that alone nowadays, on how much doc is prescribing a pain medicine to a particular patient, for example, because that's usually where you see it at, And just about, this October, I had to tell a physician that, she had a great personality, great resume or CV as they call it from a background standpoint, except a few years ago, 2 years ago, in another county in Illinois, she got reprimanded for overprescribing medicine, and we couldn't hire her. So it is very important, though, to answer your question. Yeah. But if you come to us without insurance, it's the same procedure as someone with insurance. You go through like an intake process, like being a new patient at Trinity or Genesis or somewhere like that. But in that process, there's a step that where you would apply for our sliding fee scale that I mentioned before. And most of the time, I don't know of too many cases where someone has applied to be on the sliding fee scale, even someone that was working or someone that was single. And some people say, well, I don't have a big household. Can I be on the sliding fee scale? And the answer is yes, because it's a formula, and the fee scale has different levels. So to that being said, a good chunk of those that are on our sliding fee scale, let's say you come for an acute situation, whether it's a cold or something like that, and the market rate for that appointment is $150. Well, if you're at let's say call an A on the sliding fee scale, then your out-of-pocket cost would be $20. And that's whether that appointment was a $150 appointment for a cold or a $350 appointment for diabetes management. Doesn't matter. The payment will still be that $20. And the scale just goes up, doesn't go up much from there. The next level would be $40 out of pocket. And I will say too, because there's other private practices out here that literally patients come to us and say, I had a $20 bill, a $20 or $40 bill over at so-and-so practice, and they won't take an appointment from me until the bill is paid. So first and foremost, we won't turn anyone away for money, if that makes sense. We're not a free clinic. That's a kind of a misconception. But we won't turn you. We won't say, hey, you got a $50 bill with us. You can't make an appointment until that bill is paid. We will never do that. I just want to, representing community healthcare, I want to encourage all of you, and as mentioned before, the minority communities have a history of not having as good as health or taking care of our health in the same manner as some other communities. So I want to encourage you, number one, if you don't have one, get a primary care physician. One of the things that's gone on in this day and age compared to when I was growing up, for example, is we've kind of, as a society, gone away from having a primary care physician and gone to only acute care. we only go to the doctor when some of us when it's really bad. You know what I mean? Some of us won't even go to the doctor when we're just bad. You know, when I was growing up, we had a family doctor. My mom saw the doctor, I saw the doctor, and so you don't have to all see the same doctor. But I just encourage you, get a primary care physician. You'll alleviate some of those problems that you have where you're wondering, did it really have my best interests at heart? Or a primary physician that knows you will get to know you and your body as well. So I encourage you, if you have any questions about community health care, I told Reverend Westbrook before, if you can get my info, I'll be happy to meet you somewhere and you can tour one of the clinics. There's a lot of them, Rock Island, Moline, East Moline, and I'll encourage you, the one in East Moline is right down here on 7th Street and 15th Avenue. 3 really good providers there. And last but not least, dental care, because I didn't talk about it a lot, and I know we were talking about medical care. Dental problems in our community lead to so much other stuff. I will encourage you, even if you don't go to community health care for a medical problem, we have some great dentists. There's one by the name of Dr. Stumphy in the Rock Island office on 11th Street. I would encourage you, same type of sliding fee scale is available from the dental side too. Okay, so that was it for me.
I just want everybody to just be aware of your own needs, and like we touched on, when you go to the doctor or wherever, just make sure, as you touched on, ask questions and just say, hey, I want to know what's going on. That's it. Just take care of yourself, you know, because you can't always depend on them. Just say, hey, I want to know what's going on. That's it.